Hello, hi. We are going live with Hvovi today, and we're gonna talk about all about trauma. We're gonna talk everything from A to Z. What is trauma? How can we support trauma survivors? Everything. Hi, Hvovi. She's here. Hi,
Hi,
Hvovi. I am unable
can you see me?
to see you. No.
Can you
Yes.
see me now?
Yes. Perfect. Hi. How are you?
Hi. So happy to be here on this live and on a topic so close to my heart.
Absolutely. And even like for my end, trauma is something that we've been wanting to talk about since so long. And we're so glad that, you agreed for this. And who better than you to, talk about this? So we'll just start. If you were to define trauma, Havavi, how would you define trauma in the simplest words?
Yeah, actually, trauma now in today's day and age, if you just do a simple Google search, right, you're going to find everything ranging across the whole human experience, right?
Yeah,
From a car accident or a natural disaster, going up to a breakup. So all of that is defined as trauma. And today,
absolutely.
the overuse of the word perhaps is because historically it's been underused. So, if we go back way in time, right, trauma always existed. We can't say it didn't,
Yeah,
but it was only when the military, right, people in the army in World War One and Two began showing those symptoms that actually researchers and experts began taking the field of trauma more seriously. And right up until the 80s, 70s, and 80s, trauma was thought of as happening only to people, to soldiers in the army,
yeah,
right? And maybe the purpose was to redeploy them. So that's why all the intervention and efforts went towards that. But
yeah,
then the women's movement came about in 70s, where there was the recognition that what's happening to a sexual assault survivor or a domestic violence survivor is very similar to what happens to a soldier: nightmares, hypervigilance,
mm,
yeah, irritability, really trust issues
yeah,
breaking down. All of these things also define trauma. And then from there, trauma began, the whole field of trauma took off literally like a meteoric rise. And people began thinking of it as something that should be researched in depth. But even then, in the scientific community, there was a sort of a hesitance to look at it as anything that falls within the range of human experience. It was always talked of as events that happen outside the range of human experience, such as an earthquake or a natural disaster
right,
or a soldier going off to war. But the fact is that there are so many children who are beaten up in their homes,
yeah,
and sexual assaults are more common than we realize. And all of these are also trauma, right? So, trauma is any event that overwhelms our capacity to cope. It's very different from stress, right?
right,
So actually, in the scientific field, we don't term it as trauma, we term it as traumatic stress. It's a heightened level of stress that impacts our nervous system and leaves impacts on the nervous system years after the event has happened. In
okay,
stress, what typically happens is we have resources to cope internally, right?
yeah,
Stress could be a criticism, stress could be a financial issue as well. But these don't overwhelm the nervous system, whereas trauma leaves the nervous system completely overwhelmed, right? And then the person who has gone through trauma can experience things like what we call as hypervigilance or hyperarousal or hypoarousal, in the sense they don't experience anything at all: numbness, detachment.
mm,
Now, these are often called traumatic because they're not in the survivor's control. The
right,
nervous system is responding way beyond their control as well. And that's something which is very difficult for a lay person to understand. They believe it's in the person's control, much like stress. And
yeah,
stress is within our control. We do a little bit of, we can talk to somebody about it, problem solve. In fact, just a meeting with a friend is enough to help us work through stress. That's not the case with trauma, right?
Right.
Trauma is debilitating, long lasting, and we worked with people who've been in traumatized situations that are 2 decades, 3 decades, 4 decades back, those incidents that have happened, and they are still influencing and impacting the person.
Wow.
Yeah. So, yeah. So, however, you require a trained professional to diagnose it and somebody who has the adequate training to provide the intervention for it. So, from an
Absolutely.
underused term, it's become an overused term. I hope somewhere, it
It
kind
finds
of reaches a,
balance.
a balance somewhere. Yes.
Yeah. Absolutely. So you mentioned that it's quite different from stress. How do you think we can, like, at our individual level, understand or draw the line between prolonged stress? Because we see burnout also lasting for very long, right? And stress is also something that sort of becomes very, like, it's an everyday thing. So it adds up, right? So how do you feel we can draw a line between prolonged stress or stress that has lasted for years and traumatic stress?
Stress typically won't last for years, right?
Mm.
Then we are really looking at something that might be traumatic.
Yeah.
Stress is typically transient and it is usually situation dependent, right?
Right.
The word now to define to see the difference between, so that's stress, but let's look at burnout. Now burnout is usually occupational stress. The stressor will usually be something related to the person's environment. However, we can't say that the nervous system might be impacted in an indelible way the way it is, say, with trauma. With
Right.
burnout, we typically require interventions that might mean job change, it might mean a different type of occupational focus, it might mean the person going in for some limited amount of coaching or mentoring or guidance, right? Psychiatric intervention might not be required there. In cases of
Mm.
trauma, it often is required. It's not enough for a person to take psychotherapy because the nervous system is typically pretty jangled up. So we look at traumatic stress as something that requires intervention that's both medical as well as intervention that's psychotherapeutic. And of course, you need body based or somatic intervention as well. So
Yeah.
that might qualify it as different from these. However, this is a gray area and there's a lot of intersectionality here. The Venn diagram does meet somewhere. So we need to be aware and properly understand. It takes someone with trained eyes to be able to make this differentiation. And
Absolutely.
often, symptoms with trauma will include things like hypervigilance. The person overreacts to what might be
Yes.
neutral stimuli, right? Nightmares and flashbacks. The event keeps flashing before their eyes over and over again, right? They might have sleep disturbances that last for a very long time, and the nightmares constantly are about the events that have happened.
Yeah.
Okay, so those are some typical ways in which we are going to see the difference between these various categories.
Okay. That clarifies it a lot. How do you think trauma impacts relationships and daily functioning? And, like, just give us a brief on what it looks like for trauma survivors. How is it at their end?
So let's look at two types of trauma. Let's look at traumas that are, say, single event or single incident, and let's look at traumas that are very chronic, that are what we call as complex trauma, that have been there for years together because of the dysfunctionality in the growing up years, right?
Yeah.
So let's take the first case or first incident. Um, let's take an accident survivor. This is any of my clients who are probably watching this video will know I use this as a repeated example in my clinic as well. So let's take an individual who's been in a car accident, right?
Yeah.
Say the person was driving back from work. He had a really long work day. He was distracted, and his car banged into the divider, and the car was totaled. The person was shaken up, right, and suffered physical injuries, etc. Now this individual goes to the hospital, gets his injuries fixed. His
Yeah.
family and he has a support system. All of them are there for him. typically car accidents are considered traumatic, so he's
Yeah.
obviously going to get that social support that he needs. His boss is very understanding, all of that, right? And he says, okay, take a month off from work. Then the person rejoins work a month later. And then some weird things start happening. Some of these weird things might include things like the person loses concentration post lunch, can't pay
Yeah.
attention, right, to work. He's distracted, irritable, jumpy, nervous. His nervous system, his brain, actually
Yeah.
is reading post lunch, which is when the accident happened, way in the night after he left work,
Yeah.
as a sign that something bad is going to happen. So he feels jumpy, right? If he's sitting in for meetings that extend beyond 7 p.m. or 8 p.m., he's even jumpier. He can't focus.
Yeah.
He's irritable at the drop of a hat. He's not as cheerful as he used to be earlier. And he constantly gets dreams of his loved ones dying, or if he sees a movie that he never reacted to earlier, let's say
Yeah.
something that had a sexual violence or anything like that, he reacts even more strongly now than he ever did previously. So he has these reactions. However, Komal, people don't make that connection. They don't
Yeah.
make that connection so easily that, oh, this was because of the accident. They say we got over it. It's in the
Yeah.
past. And even if these reactions continue 6 months, 1 year, 1.5 years later, by which time their ecosystem has also been impacted, you can
Yeah.
just see how many more minor traumas would have been added on to that bigger trauma. Now,
Yeah.
let's say he has an empathic understanding ecosystem around him who say, buddy, you look different now compared to a month, 2 months back, so you better meet a therapist. When he meets a therapist, they are going to see those signs of PTSD, post traumatic stress disorder, in the individual, and thus starts treatment. Now,
Yeah.
this is in the event that we have those blessed souls who have a very healthy childhood environment and have suffered a single incident trauma in their adult life. If you find those souls, please send them. I need to see them once in a while. I don't see them very often. So we come
Absolutely.
to the second category, which is people who may come in with a single incident trauma. Those are also very rare. But if they do come in, there are a lot of people who have childhood baggage,
Yeah.
so to speak. And most people who come in for therapy will come in with these similar symptoms as PTSD, hypervigilance, and
Yeah.
difficulty sleeping, irritability, concentration problems, dissociative symptoms such as feeling checked out from the environment or feeling depersonalized, sort of not connected to their feelings, emotions. And when we take their histories, then comes, all of the material that they have been through, which defines their present life. And people who come with these sort of diffuse symptoms, which don't seem to make much sense initially, they sound something like depression, something like anxiety, will
Yeah.
often have complex trauma. And they will have backgrounds where they may have suffered big traumas such as sexual assaults, child sexual abuse, violence in the home, or
Yeah.
witnessing violence, alcoholic parents, but they may have also witnessed what we call as small t traumas or face small t traumas, which might include bullying, neglect, abuse, or verbal abuse. There may be no marks on their body, but these people have bruises on their soul, so to speak.
Yeah.
And these are the individuals who a large number of us therapists see a large population of this
Yeah.
sort. So these are the presentations of these individuals. With post traumatic stress disorder, it's a lot more categorized. We know it. With complex trauma, it's a little more difficult to understand it, but there will be identity disturbance. There will also be the typical PTSD symptoms, but also difficulty in emotional regulation. So there'll be
Yeah.
those added complications apart from the post traumatic stress disorder symptoms that you see. So that's
Right.
typically how they present.
So it is way more like, beyond and much bigger than uh, all these disorders that we hear about. Like, I mean, we do
Yeah.
study anxiety disorders, panic disorders, PTSD, as you mentioned, but it's sort of an amalgamation of so many of these
Well,
symptoms. Uh,
with trauma, it might be these particular disorders might be symptoms rather than
yeah.
a biochemical reaction in the brain. Which
Okay.
so when we are classifying depressive disorders or anxiety disorders, they will come also with certain criteria.
Yeah.
However, the person doesn't meet all the criteria and seems to be showing a whole multitude of conditions,
Yeah.
we always should look for a signal that goes back to traumatic experiences in childhood, right? And treating the symptomatology simply means that the symptoms will come up in another form if we don't treat the root.
Absolutely.
Whereas with
Absolutely.
depressive or anxiety disorder, we treat the symptom and it's fine. The person goes back.
Yeah. Absolutely. So if you were to say, what would be some self-care strategies for trauma survivors as well as caregivers?
That's a great question. So, in terms of self care strategies, I think the first and most important aspect of self care is seeking psychotherapy. Uh, I
Absolutely.
don't see self care as a therapist, I don't see it as only massages or, aroma oils. Self care goes beyond that. Just the
Yeah.
tip of the iceberg, according to me, is all the relaxation skills that we talk about. But a deeper form of self care is really taking care of the root of the symptoms and managing the nervous system, right? So, in psychotherapy, the individual is going to first normalize these various symptoms. So, that's a huge part of self care, learning to recognize that it's the nervous system that's reacting the way they are to environmental stimuli. That's a huge part of healing too. So, they don't see themselves as abnormal and they don't label themselves with tags like crazy, etc. So, taking psychotherapy is important. Oftentimes, part of the healing is also part of self care is also adherence to a medication routine if it is prescribed by a psychiatrist. Sometimes a psychiatrist might agree medication is needed, sometimes they may not. But if it is their part of self care, is also adhering to a regular medication routine. And then comes the other things in self care is included bonding with people and finding that support system around. Even one person is
Yeah.
enough for a trauma survivor where trust is so irrevocably broken, finding that one person that you can trust is also a huge deal. Just one or
Yeah.
two people is enough in the support system. And then there are a number of mobile apps available today. PTSD Coach, iChill, for example. We have Visa in India. We have Insight Timer. So using these apps, mobile apps, that's really great.
Yeah.
There are also a number of people these days who coach you on nervous system regulation. Okay,
Okay.
so in our nervous system, we have what we call as um, our parasympathetic nervous system. That is a part of our nervous system that helps us regulate and calm down.
Yeah.
Okay, and in the parasympathetic nervous system, we have something called the ventral vagal branch. That's the part of our nervous system that helps us stay connected to the here and now. It helps us see
Okay.
the world as it should be seen, not through trauma eyes, but through the here
Yeah.
and now, which typically means the person is oriented in the present and they are not being disturbed by the past going on flashing in
Right.
front of their eyes. So they don't react to even innocuous triggers like somebody's facial expression or somebody's tone of voice. They don't react to it adversely. So today there are a number of people who are helping the nervous system regulate through variety of exercises, right?
Yeah.
And these go by various names on YouTube or you'll find them anywhere on Instagram also. People who coach you on how to regulate your nervous system. I find those are very helpful. Certain types of posture, certain types of breathing techniques, lying down techniques, things that you can do to activate the ventral vagal nervous system. That's another huge part of self care. And then, according to me, all the other stuff does come in. For example, relaxation skills
Yeah.
or learning to know when you are really deeply upset and learning when you need to withdraw from the world, but also when you need to engage, soothing aroma oils or massages
Yeah.
or watching something that's less disturbing or distressing. Yeah, for trauma survivors an important thing is stay away from triggers. So when you're choosing what you're watching on Netflix or you're choosing what you're watching on YouTube, make sure you're not choosing something that's going to re-traumatize you and you're having nightmares and dreams without even realizing.
Yeah.
So choosing what you are consuming is also very important. So just those are some of the self-care strategies.
Um, this makes me wonder, do you believe generational trauma? Like, I mean, we hear about generational trauma a lot. Like even on social media, there are people posting about it, people joking about it also. That oh, trauma has been passed down because my mother was like this. This is why I am also like this. Do you believe, like, how does that work? Is it actually a thing?
It is a thing, right? It's a thing
Yeah,
because suddenly the US has woken up to it.
yeah,
We did, before that happened, nobody even realized it existed.
yeah,
But the fact is, in India, it's probably existed way before it existed in the West, or the West came
yeah,
to know about it. And that's because, of course, we are an ancient civilization. So
yeah,
intergenerational trauma does happen. However, I need to inform people intergenerational trauma doesn't mean you're carrying a trauma gene that sort of shows up in the child, right? This is
yeah,
not like black eyes and black hair. You
yeah,
don't carry a trauma gene. But intergenerational trauma might be passed on if you have a parent who is disturbed. You're obviously going to have a child or not
yeah,
be fully present for a child. And that
yeah,
might pass on some of that trauma to the child. Or they may react or respond to the child by hitting them or
yeah,
by not being available for them and neglecting them. So in those ways, the trauma does pass on. And uh, in generations before ours, where therapy and help, and there was so much stigma around mental health,
yeah,
people didn't take help. Today, I can see that parents do come in telling me, the one thing I don't want is for this to pass on to my child, and I
yeah,
will do anything for that.
yeah,
And that is again thanks to the awareness that's being generated around mental health, thanks to people like you who do talks like this, that there is less stigma and people do reach out for help. So
yeah,
we are looking at probably developing healthier and more resilient generations in the future where that intergenerational trauma doesn't pass on. But one of the things I can tell you, Komal, is that we have grown up with multiple traumas which have not been researched that much. There are few researchers who talked about the trauma of the partition. The intergenerational trauma effects are being seen in the kids even today. The
yeah,
displacement of the Kashmiri Pandits. That's another place we are seeing that intergenerational trauma occur even today. And now look at all of what we have already, the mess we've created in the past
yeah,
20 years or so, is again what we are passing on to our kids. Right? So, intergenerational trauma is not just your responsibility, mine, it's a community responsibility. And we need to
absolutely.
make sure we are creating a safer world
Yeah,
for
yeah,
our country, right? And not having these kind of terrible, disastrous events happen around us, where the
yes,
generations are going to see the impacts, right? So it's a community responsibility as well.
yeah. Like you said, you mentioned Kashmiri Pandits and separation. Do you think, like, this is just out of, from the top of my head, do you think COVID is going to be something that's, uh, you know, especially for the ones who've maybe lost somebody in COVID, or, or have had traumatic stress per se, that has started during COVID and is still there? Is that going to become like a part of intergenerational trauma maybe 10, 12 years down the line?
Good question. I don't think I know that it will,
Yeah,
but I also know that the mitigating influences in terms of the awareness we've had, the interventions we've had, are far more than we had in previous natural disasters,
yeah,
right? So we know that those mitigating effects are very important.
yeah.
Mitigating effects that are there for Komal, is my connection breaking?
No, no, I can see you.
No,
I
it's
can hear
fine.
your voice.
Okay, okay, it got stuck for a bit. So what I was saying is that definitely COVID is going to have an impact,
Yeah,
right? When we look back, we're probably going to divide our life as pre-COVID, and we still do. No, in
yeah,
everyday talk, it was we say previous to
yeah,
COVID and after. So we've
yeah,
already started doing that. We're just 4 years into the pandemic. 15, 20 years down the line, we're still going to be seeing those things. The interesting question that researchers are raising is how much it might impact children. A child
yeah,
born in COVID, what kind of influences or impacts we might see.
yeah,
We'll have to wait and watch. All I
yes,
can tell you is that it is unfortunate, but it also means we have to devise better tools and interventions to manage these type of events as well, which
yes,
nobody had planned for, right?
absolutely.
However, I can tell you that the amount of interest that was generated in mental health in COVID, I have never seen in my 20-year career.
That's
So
true. Like,
to me, that's
just
a huge,
general awareness increased. Yeah.
absolutely. Kids who were in tier 2 and tier 3 cities who had no access to mental health support, they were the ones who could reach out through a mobile now and access a
Yeah.
therapist for free because free
Yeah.
counseling was available and is still available today. We
Yeah.
didn't have access to all this prior to 2020. So the support, so it might be a huge trauma, but there has also been enough support. So for me, it's a time of hope that we are looking at also in the future.
That's great. Because you mentioned children, how do you think, and if at all, is trauma different for children and adults, like in the way that it affects you?
Yes, it is different. So there are, when the Bhuj earthquakes happened in 2001, and then when the Kashmir floods happened 2014,
Yeah.
these were two large-scale disasters where I had personally visited with teens and worked with children, primarily with children, right?
Yeah.
And that's where I was exposed to really how children show the impacts of trauma. We
Yeah.
see it in the clinic as well, but seeing it in large scale, mass scale like that is very different. So with adults, they can talk about it. Children won't.
Yeah.
Most children never talk about it. So they typically display it in the form of nightmares or in their play.
Yeah.
They will display it in terms of school absence or school avoidance.
Yeah.
They may it may show up in the form of aggression and violence that has never been there in the child prior to trauma events. It may
Achha.
also show up as extreme withdrawal. The child may be lost in their own world, not interacting with people around them, not engaged. So, children often don't have words for what they feel internally. It's the adults in their lives who have to teach them how to put those feelings into words.